Glucose is really important for high intensity exercise. Without glucose availability, we won't be able to perform high intensity exercise. So how we get blood glucose into the muscle, and also how we replenish that blood glucose to keep supplying glucose to the muscle, is important. So let's talk about that here. So exercise is going to decrease muscle glycogen, because glycogen is that stored form of glucose in the muscle, and we're going to be breaking it down to use that glucose within the muscle. We're also going to be taking in blood glucose in order to continually fuel the muscle with glucose. When we're doing that, we need to start tapping into the liver glycogen. So liver is our other big storage source of glucose. It has a lot of glycogen, that stored form of glucose, in it as well. So we're going to be doing that by activating the pancreas to release glucagon. Glucagon is going to increase liver glucose release alongside some other things that are going to increase this, so epinephrine, norepinephrine, and cortisol. But glucagon is probably the most important of these hormones in terms of increasing blood glucose availability. Here in this figure, we can see 3 hours of aerobic cycling exercise at about 65 to 70% of VO2 max. So the time is on the x-axis. We have 3 different y-axes that are color-coded to the 3 different lines. We have a decrease in muscle glycogen over time as we utilize more of that glycogen to break it down into glucose and use it for glycolysis and energy for the exercise. We are going to then have to start utilizing blood glucose and bring in that blood glucose to continue fueling the exercise. We do see an increase in blood glucose initially before it decreases over time. That increase is going to be fueled by an increase of the glucagon being released by the pancreas. That glucagon is going to stimulate the liver to break down its glycogen, releasing glucose into the bloodstream to allow us to fuel this exercise and have a second source of glucose other than the glucose that's already in the muscle. So this is a good process that helps us to exercise at high intensities for longer periods of time. Let's talk about how we get the blood glucose actually from the blood into the active skeletal muscle during exercise to help fuel that exercise session. Insulin is higher at rest than during exercise, and it's going to be activating GLUT4, which is the glucose transporter type 4. The job of this transporter is to go to the cell surface and essentially facilitate the process of bringing glucose inside the cell. This works in both adipocytes, which is fat, and muscle cells. GLUT4 is the major method of getting blood glucose into the muscle cells, so it's really important for getting that blood glucose in. Notice though, during exercise, the insulin is going to decrease over time. This is the red line here. This is going to help with the boost in blood glucose that occurs, as well as the increase in glucagon that we've already described, which is going to also help with the boost in blood glucose. But by doing this, we aren't going to be able to activate the GLUT4 using insulin anymore. So how does the active muscle cell, continue to bring glucose into the cell when we don't have the insulin there to activate GLUT4? Fortunately, muscle contraction also activates GLUT4. So although we have a decrease in insulin activation of GLUT4 during exercise, we have an increase in the muscle contraction activation of GLUT4 during exercise. The good thing about this is going to stop cells that are less active around the body from bringing in the glucose. They don't have insulin acting on them to bring the glucose into the cell, so they don't bring the glucose into the cell. So that, again, increases how much blood glucose is floating around for the active tissue to then be able to utilize. That active tissue, which can activate its own GLUT4 without insulin by just the muscle contraction, it then gets the preferential treatment and preferential supply of the blood glucose inside that cell in order to continue to fuel that muscle cell to be active during exercise. Exercise is a major stressor on the body. It does not just affect the ability of the body to maintain blood glucose levels, it also affects other things like electrolyte balances. We're going to be talking about that in another video.